My name is Michelle Sodipo. I'm a first year PhD student in the Population Health Sciences program studying cancer epidemiology. So I did my undergraduate degree at Tufts University, and I studied biology and community health at the time. And my main focus during my undergraduate degree was in infectious diseases and how it impacted communities of color. I did realize chronic diseases also impacted communities of color very negatively, and I wanted to figure out ways to alleviate that pain that a lot of people of color are feeling. So after working for a bit, I actually got my master's in public health at Yale University. And that's where I discovered cancer epidemiology. And I realized that a lot of the cancer research being done in the United States really focused mainly on non-Hispanic white individuals. And I wanted to figure out, okay, if there's not enough people in these studies, then we can't make any conclusions about how cancer is actually impacting everyone else. And so I decided to pursue this and come to Harvard and take a deeper dive into figuring out how, as a researcher, I can make an impact. It's not only like a personal passion, but also something I thoroughly enjoy doing. I am interested in the elimination of racial disparities in order to increase survivorship in communities of color who have been affected by cancer. So that includes figuring out how to increase communities of color in clinical trials, looking at survivorship and figuring out factors that improve quality of life, and then also taking a stab at implementation science. So figuring out actual methods that can change the disparities that we're seeing currently in the medical field today. I came to Harvard because I wanted to have an environment where I felt really great about the academics and the opportunities that came with going to classes, but also having and being part of a lab where I felt very supported and where I felt I would have a really great mentor. So on the academic side, Harvard has a plethora of classes. So I was really drawn to that aspect, but also my advisor, Lorelai Mucci, is fantastic. And I really connected with her when I was interviewing and just reaching out to different schools. And I felt that working with Lorelai, not only would she be super supportive, but I would also have the opportunity to grow and meet like minds, but also learn from people who have been doing this for a really long time. Being in Boston, you're essentially at the center of some of the biggest hospitals and organizations like Dana-Farber is here, BMC, Children's. There's so many opportunities and collaborations possible. Currently, I'm working with a individual over at Mass General Brigham, and they're also doing cancer disparities work, but I wouldn't have that opportunity if I wasn't here at HSPH. So the academic environment at HSPH is definitely rigorous, but I think there's a lot of support that comes along with taking all of the classes that we have. The community that I've built coming to HSPH is definitely none that I've ever had before. I'm very grateful to have the cohort that I do. As a first year PhD student, I'm taking a lot of classes, but I am very grateful to have a cohort that's very close knit. We study together practically every day. We hang out, we have dinners together on a weekly basis. It's also a great opportunity to spin off ideas about research that we have and to get different perspectives and opinions. It's been an amazing opportunity to not only build myself up intellectually from the classes that I'm taking, but also build a network of amazing scholars who I know I could collaborate with in the future. And I'm looking forward to become an amazing researcher because of the people around me as well.